Hello, everyone. Mark Becker here. Thank you for joining us today for this webinar. It's 1 o'clock Eastern Time, right on the dot. So, want to be cognizant of everybody's time and allow time for the to present and also to have everybody ask questions. As you're going, we're gonna answer questions at the end, but feel free and please do as you think of them. Put your questions in the question box there in the GoToWebinar control panel, so that you don't forget, and we'll answer those as we can towards the end of the presentation. So we're gonna really basically we have a whole lot. Oh, there we go. Sorry about that. A little echo there. We have the team with Intermountain Healthcare Foundation with us today, along with Andrea, who is their account manager on the Cathexis Partners side. And we're going to go through kind of an overview of the implementation and the outcomes to date and what kind of results they've seen. So let's go ahead and jump in and start with introductions to the speakers from top to bottom. Rebecca, if you want to go ahead and kick us off.
Sure. So I'm Rebecca Anderson. I am the Programmatic Giving Officer for Intermountain Healthcare Foundation. This is a new role. The Intermountain Healthcare Foundation actually has gone through a redesign to further centralize various functions. And so I help to oversee 3 teams focused on events, donor relations and stewardship, and annual giving.
Great, thanks. Brittany?
Hi, this is Brittany Rowland, and I am a development coordinator with the foundation, and I work primarily with events.
Excellent. Natalie?
Hi, this is Natalie. I am also a development coordinator, and I work specifically with the annual giving team.
Great.
Hi, everyone. I'm Danielle Marzelli. I'm the annual giving manager. And so our team works with donors who contribute everything from 1 penny up to $25,000. And we work on multi-channel annual giving campaigns, so traditional direct mail, direct response, giving days, and individual solicitation.
Hi, everyone. I'm Lisa Schofield. I'm the manager of stewardship and donor relations. And we do stewardship and donor relations for the entire system. And we're working on trying to get a program in place that has not been in place in the past. And so we are organizing around that.
Hi, I'm Emily, and I work on the stewardship and donor relations team, and I am the development coordinator for that team specifically.
Great, thanks everyone. And I'm Mark Becker. I'm the founding partner of Cathexis Partners. And then last but definitely not least, Andrea.
Hi, I'm Andrea Fleischer, and I work with Mark here at Cathexis. I am the account and project manager who helped take Intermountain Foundation onto a new platform, Luminate Online, and worked with them on all the steps of the implementation.
So again, we're going to do an overview of the migration itself. Then the events team is going to talk about how they've been using Luminate Online, and then annual giving, followed by stewardship and donor relations, and then kind of wrap it up with the keys to success, and then leave time for Q&A. So kicking it off as a migration overview, Andrea, you want to speak to this?
Sure. So Intermountain came to us a little over a year ago, and we were tasked with helping them migrate several of their things. They had been on Blackbaud NetCommunity for a number of years, and they were ready to make a change. So we were there to help them move some of their core functionality from NetCommunity and other systems onto Luminate Online. And so we got our feet wet really quickly with an event that you'll hear about more in a minute or two, and how to set up certain sign-up forms for that. And the great thing about working with this team at Intermountain is how organized they were and they had very good rigor around how they were managing this project. They had one or two very specific points of contact who coordinated all the to-do items and all the meetings and so forth, the meeting agendas on their end. And I found that very helpful because there were so many voices in the room, and everyone's got kind of a different priority and a different focus. And I just wanted to mention how helpful I think it was for them to have a point of contact on their end. And then we had a point of contact on our end, which was me. And we pulled other members of our team in to help based on their expertise as the project went on. So there were a few phases to this, and we'll show you more about what we did bit by bit.
Rebecca, anything to add to that?
Yeah, so I think the other thing I would want to add is one thing that I think is important to point out, especially if anyone happens to go to look at any of the functionality that we're implementing. We have not used Luminate Online to build out an entire platform for the foundation. We're in the early stage of implementation, and we're implementing various functionality into our existing website that is actually managed by Intermountain Healthcare's marketing and communications team. But we are hopeful that over time we'll continue to implement various components of Luminate Online. So we're really excited about the overall functionality that the product offers clients, but we're just starting with various pieces of it. And I would also add that I think in speaking to other organizations that have purchased Luminate Online, I think having an implementation partner and like Cathexis is key. We would not be where we are today without this amazing partnership with Mark and Andrea. And they are very knowledgeable about the product itself, and they're fabulous partners and have really allowed us, I think, to have success early that I think other organizations maybe struggle and are maybe questioning why they purchased the product. So I think an implementation partner is key in if you want to undergo implementation of Luminate Online.
And the check is in the mail. I think I need to pay you for that endorsement. Thank you very much. But yeah, their team, all kidding aside, their team was just brilliant throughout this process, and really starting off like Andrea kind of alluded to with something that Brittany's going to cover here on the next slide, which was their very advanced in-depth festival of trees and everything around that. That was really the first thing we kicked off with and set the tone for the rest of the project. But yeah, Brittany, you want to go into this some more?
Yeah, definitely. And before I start, I want to second what Rebecca was saying about using Cathexis as an implementation partner. We had kind of a lot to accomplish, and it was a bit complex for what we were looking for, and it was just a wonderful jump into things, having somebody like Andrea that's so knowledgeable, being able to guide us through and tell us the best way to kind of handle the things that we need to get accomplished. So that was great having you guys there to help us with that. So with implementation since 2018, when we started, we've been able to do 16 ticketed events through Luminate. And then we've only done one RSVP event. Both were very successful. We also have had, we've created 41 surveys that are just event related. The majority of those are for our Festival of Trees event, which I'll go a little bit more into in a second. For our emails, we've actually sent over, and this is just event related, 72,000 emails have been sent. And this is just since the fall of 2018 since we've implemented. And we were able to track with Luminate our average open rate. So for those emails, the average open rate is 29%, which isn't too bad. So it's been really nice to be able to kind of control that and see how many people are opening and forwarding and engaging because of those emails. With Festival of Trees, it's our largest event that we have in our foundation. It's a 5-day event, and we have more than 100,000 attendees that attend over those 5 days. We have around 10,000 volunteers. And then we also have an auction that happens during the events where we have about 1,400 auction items that all kind of come together and we do in one night. So with Luminate, to help us prepare for that event, we set up 10 surveys that helped us capture the auction items. This being like our trees. So the event itself is this large convention center, and it's filled with Christmas, basically. It's trees, gingerbread houses, treats, there's quilts, there's playhouses, a ton of wonderful things that are all auctioned off to benefit Primary Children's Hospital. So with all of the stuff in this warehouse or this convention center, we have to capture it and organize it. And so we created 10 surveys that helped us capture the 1,400 auction items. And then we also created 10 more surveys to help us capture and organize the 10,000 volunteers that we had for the festival. Will you go to the next slide?
Yep.
Thank you. So with festival especially, to pinpoint the save staff time, I think this was, if nothing else, the biggest benefit at the time to using Luminate to gather and collect this information. So in the past, we have actually had to be able to get the donation information and the staff volunteer information. It took 2 people, 2 full days a week to get just the information into our Razor's Edge system. So it's 64 hours a week, usually starting around July and going until the event happens in November and the beginning of December. So once we implemented Luminate, it is now one person, myself, that spends about 30 minutes to an hour a day putting that same information into our system. So that has drastically, that's 2.5 to 5 hours a week tops that is now spent working on this versus the 64 hours that we've had in the past. So that just alone is a huge save on staff time. And that's just talking about the getting this stuff into the system. That's not even talking about the volunteer time that we saved organizing that and getting that to our festival board members and such. There was also so outside of our programmatic giving team, there was also another team that worked on trying to get to the information into a second system called 2.0 that we use to actually help us run our Festival of Trees events. And they spent about 3 people, 3 full days a week, so it's 72 hours a week, trying to get that organized. But with Luminate, we're able to kind of get everything organized in a way that it is, again, now one person at 30 minutes to an hour a day tops, and then it goes to our IS team for importing. So we're able to take a lot of user interaction out of that because we're able to capture the information correctly on the front end of things versus trying to organize stuff and get it ready on the back side of things. The second part of it is reducing customer service issues. So out of the 1,400 auction items, the 10,000 volunteers that we pulled in through Luminate, we did not lose one scrap of data, which was kind of remarkable. In years prior, in our previous forms that we used, we would have issues with somebody saying that they went online and they filled out a form and they would show up the day that we set up for the events. It's called Decorators Day. So they would show up with a large tree or show up with their items ready to set up, and our volunteers would not have any record of them. So you can see how, one, that would be a stress on the donor because they're kind of going out of their way. They've made this wonderful item or put this tree together. And then it's a stress on our volunteers because now they have to scramble and try to find, where are we going to put them? How are we going to stage this? but last year, I believe, was the first year that we have not had one misplaced form, and we had every single donor and volunteer accounted for, which was absolutely incredible. And I have to say was because we used the Luminate surveys and the forms and just the way that it was the ease of getting the information. And we had 0 people complaining that there were any bugs on pages or anything like that to where they weren't able to submit. Another kind of thing that kind of verified that this is working really well for us is we actually had just one Festival of Trees form that lived on our old platform. And it was only going to collect maybe around 300 names with some information on them. And we had almost every other day somebody complaining about information not being submitted or not getting a kickback email or information that they thought they submitted. And then when we sent them their lists of what they were supposed to submit, and it showed that they hadn't yet, we actually had to use our staff time to go in and manually put that in again because we didn't want to ask our volunteers to have to go through the process again. So the good news is this year we are implementing that last Festival of Trees sign up in Luminate. So when I announced that last week at one of our festival meetings, there was applause. So everybody was pretty happy with that. And I'm quite excited to see how well that goes this year. And that kind of goes into the more accurate, more reliable data because we're able to capture everything and data's not been lost. It's been a lot easier and a lot less stress on staff and volunteers and donors because we have been able to get everything that they have submitted. And then also too, I'd like to say that the ease of use on Luminate versus the platform that we had used before is night and day. It's very user-friendly. I feel like I don't have a lot of background in like HTML and web development. I've done a little bit, but I was able to step into this and use it very quickly, very easily. And that was hand in hand with what Cathexis was able to help us implement and to train us on how to use, but also just the ease of the program itself, being able to go in and understand what things mean and how to change something and have that change reflect immediately or whatnot. But it was extremely easy. And I think also too, one last thing is that in the past we had one or two, I want to say, people that had the ability to work on like sending emails out on behalf of us, updating web pages, updating surveys. So we had minimal people that had the ability to go in and do that on our old platform just because it did take a certain speciality to do it. Now we have 5 or 6 minimum that are able to go in there and make the changes needed. So if something needs to happen immediately and our one person in the past was out of the office, we kind of had to scramble a little bit to try to find somebody else that could do it for us. Whereas now, if there's something that needs to be done, we have quite a bit of backup for people to be able to go in and make those changes. So again, another, point back to saving staff time and, implementing things when we want to implement them for the biggest impact.
And Mark, this is Rebecca. Can I make one really quick comment about the saved staff time that I think is important here? Because of the fact that we were able to eliminate the number of caregivers on our team who had to do data entry for this event, we were actually able to implement something that we wanted to do that was donor engagement related with our top, we call them top flight. And these are the donors that attend Festival of Trees and spend $10,000 or more at the event. And because of our saved staff time, we were actually able to develop and implement an event as part of this overall opening night that was meant to engage and steward those really key donors to that event. And had we not implemented Luminate Online, we wouldn't have had the staff time to do that. And that's more important to us, to be able to have that donor engagement element versus having to do data entry. And so for me, that was a huge win. Not only the fact that, as Brittany has pointed out, all of these other benefits, but for me, it was being able to take our staff resources and redirect them to an area that's going to have more return on investment for us over the long term with our donors.
Oh, that's terrific. No, thanks for sharing all that, Brittany. And are you already hard at work on planning Festival of Trees for this year, or?
Oh yeah, that started in January. we're into it.
Nice. I'm sure there's a lot of moving parts to it. That's great. Thanks. All right, let's move on to the annual giving team.
Great. Thanks, Mark. This is Danielle Marzelli, the annual giving manager. So I'll just tee up this section by sort of saying that the state of our annual giving activities has really been quite traditional and still continues to be quite traditional. And our donors are in so much that our donors are well trained to respond to direct mail pieces and other sort of fundraising in their community, but it really is that, they get mailed to their house or somebody asks them face to face. So working with Cathexis and implementing Luminate has really marked the beginning of us dipping our toe into electronic communication. So we're pretty far behind the 8 ball in terms of industry trends. And so one takeaway that I hope you get from our experience is that we still have a long way to go, and the little that we have done has been very successful and required very little effort, thanks to Cathexis and thanks to Luminate. So Natalie is going to talk about our success and our strategies around that. And for the purposes, and really where we've started, we have our entire health system that is involved in annual giving, and where our donors are the most active with annual gifts are with donors to our primary children's hospital, and also in the southern part of Utah, where we have 2 local hospitals and a community that's very engaged in the hospitals and very engaged in our direct mail program. So I'm going to pass it off to Natalie to talk about our strategies, but just wanted to set the stage.
Perfect. Natalie? Thanks, Danielle. So as Danielle mentioned, our strategy that we have on our annual giving team is to send out direct mail appeals throughout the year. And in our St. George location in Utah, we send out a quarterly appeal. And we decided with Luminate this year to couple that with an email and to test and see what that might look like in sending a direct mail appeal along with an email to potentially the same donors. And so with this email, we were able to include a video and more information and context to a patient story, and really provide a way for donors to easily make a contribution instead of having to send it in through the mail, which donors still love to do, but this gives them another opportunity and another way to donate. In this email, we included a video and a link to our survey that we created with Luminate, which provides them options of where they would like their donation to go with the hospital. And so this email had a really great a great open rate. There was about 35% open rate with this email, which is a really great beginner result, I think, because we've never done this before, and it was a great way to test and see what it might look like, especially with the demographic we have in St. George, Utah, where they're used to getting that physical snail mail and like holding something in their hand. It was a great way to test and see that they really do open email and respond that way. So anything else you want to add to this specific campaign?
No, I think I got it.
Great. We can go to the next slide. So one of the other direct mail appeals that we do throughout the year is with our children's hospital, primary children's hospital. And we send out different appeals, one for the cardiac center, one for cancer, one for, cardiac, oncology, NICU, and neurology. And so with our new implementation of Luminate, we decided to put a URL on our direct mail piece that links specifically to this campaign. Instead of putting our general giving website URL on our direct mail piece, we coupled it with the specific location for this campaign. This allows us to see who's getting direct mail appeals, and how they're responding. So they have an opportunity to send in a donation through the mail, but then they also have an easy, accessible way to make a contribution specifically to that campaign instead of going to our general giving page and having to make multiple clicks to find the right place to make their donation where they want it to go. Anything else you want to add with this one?
Yeah, and I love this example because for any of you who are listening who are well versed in online giving and social media, the sort of custom URL and mini giving site is sort of SEO 101. So it feels like a very basic leap from that perspective. And when we see gifts come in and we know that this person did come across this giving site and make their online gift because of that direct mail piece, it really shows us it just gives us so much information. And so even though this is a very small step in what we hope is going to be much more, kind of streamlined and complex, we'll roll this out for all of our direct response. Just doing this one step has really helped us to know more about our donors, to provide more evidence for the efficacy of our direct mail pieces, and also allows us to steward those donors appropriately, because we do send custom stewardship pieces to the donors that give to these appeals, because we want to say, okay, if this appeal is for Tegan and about and it's Tegan's story and about her being a heart patient in Primary Children's Hospital, we send a stewardship piece that also features Tegan. So it helps us to steward our donors and not just see that they're making gifts online and we don't know how they heard about us. So it's, again, feels very basic, and it has really created a big difference for us in how we engage with our donors.
Yeah, overall it's just tracking. We get a better handle on our tracking of what our donors are doing and respond effectively.
Absolutely. Well put.
Great. We can move to the next slide. So Danielle, do you want to go ahead and take the lead on this slide?
Yeah, so I'll talk about this one. So we Intermountain Healthcare, we have close to 37,000 caregivers. That's the word we use for employees. So 37,000 employees that work for us, and we engage them in an annual system-wide giving campaign, which is 2 weeks every fall, and we call it our I'm In campaign. And most caregivers sign up to donate back to the hospital, back to programs within our system, but also we give them the ability to give back to the community through the United Way and other not-for-profits. Most folks give through payroll deduction, but we also want to give the option for people to pay with to donate via credit card. And so this site was also sort of like a small step, but it was very significant process improvement for the user end experience making donations through this campaign, and also how we process their donations on the back end. And how this became streamlined is all of our giving sites are set up facility specific. So if someone wants to give to Primary Children's Hospital, they go to the Primary Children's Hospital giving site. If somebody wants to give to Logan Regional Hospital, which is in northern part of our state, they go to that specific hospital site. Because our caregivers work system-wide, and perhaps they work at one facility and they are a patient at another facility, and their child is a patient at another facility, and their parents are patients at yet another facility, we provide caregivers the option to give to all of our hospitals. So rather than say, here, employees, choose your hospital and have a bunch of click-throughs to get to the specific hospital giving site, we wanted to consolidate that into one site where they could just use this drop-down and say, I want to give a gift to this specific program at this specific hospital, and also I want to give one over here, and I want to give one over here, and I want to give one over here. And the Luminate site is different, so that's what makes this site unique from our other giving sites. Additionally, what makes it unique from our BBNC site is previously, because we want to provide all of these options for our caregivers, on our BBNC site, it was just a laundry list. So they would the drop-down would just be, here's a hospital program, and there was, I think, maybe 27 options. There was a lot of options, probably too much. But because of our Luminate site, we've been able to make it organized in a very logical way. So what this meant is just, again, creating a nice user experience for our staff, and also helps us on the back end to process those gifts more efficiently. And Brittany set up this site in conjunction with Andrea. So kudos to both of them, because there's a lot of giving options. So I just want to give them credit for actually doing the work. All right, we can go to the next slide.
Perfect. So this campaign was at the very end of we're a fourth quarter business, so we push at the end of the year to help meet our goals. And we decided to put together an email to send out to all of our donors at Primary Children's Hospital that we had an email for. And this was basically an email asking them to double their donation that they made throughout the year. And in return, we would give a balloon to a patient at the hospital to celebrate the new year. And what's so unique about this email is that we didn't have the time to create a traditional appeal, creating a story and everything that we would need to send to the mail house, to print, and get everything ready to go. We just didn't have the time to do. So this was a really great way to quickly put something together and see results quickly. We sent out a total, I think we had maybe, I'm not sure our exact number of how many we sent it out to, but we had a total of 30 gifts, raising $6,000, which was a really great return. We sent out an initial email, and then about 2 or 3 days later, we sent out a second email to all of those who hadn't responded to the email yet, which is a really cool, I think, tool with Luminate. There's a specific aspect that you can see who's responded to the email and then who hasn't, and specifically send an email to those people on the list. So we utilized that, which was definitely beneficial. Anything else you want to add? I think this is just a really great example of how quickly we could put something together and see a return and have great results with minimal effort.
And what I love about that, Natalie, is that it also breeds creativity among our gift officers, because it was one of our gift officers that just said, hey, I have this idea. We're like, sure, let's do it. And I mean, really, mere moments, not mere moments, but in terms of the time spent, we were able to take that risk and just kind of see how it went. If we had no return, it really didn't require any staff time. It didn't require any additional funds. It was such a quick turnaround. So we were really pleased about that and look forward to using Luminate to foster more of that creativity and those sort of in-the-moment ideas.
Yeah, that's great.
I think it took us about maybe 2 or 3 days to put it together, whereas with a traditional appeal, it takes us a couple months. So it was very effective.
Nice.
Perfect. And then this is something that we're currently working on. So we have a 97-year-long tradition campaign called Pennies by the Inch. And traditionally, it has been a campaign where people in the community go door to door asking for donations to help support our hospital, for Primary Children's Hospital. And this year we decided to expand our reach and take this campaign online through a sort of peer-to-peer lens. So there's a lot going on with this project, and so I hope I can articulate it the best possible way. But what this portal, it's going to be serving as a portal for peer-to-peer giving, really. This specifically, Pennies by the Inch, is a website that donors can go to either be a part of a team in raising money for the hospital, or they can simply create their own team and fundraise on their own. They can hold a lemonade stand. They can do something in their community to help raise those dollars. And this is a place where they can help get the community together, and it's all on their own. We just provide them the support that they need. And then they can also just simply donate to the hospital. This website will provide toolkits for what you might need in order to do your own fundraiser. And while we're using this specifically for Pennies by the Inch, we hope that this can serve as sort of a template for all of our future fundraising for peer-to-peer, where we can use this for other campaigns and really for whatever the community would like to do to help support the hospital. So this is just the beginnings, and we're really excited about the potential for this campaign and for the opportunity to engage donors with our third-party fundraising that we see in our community. Anything else you want to add? This is a huge project, so I know there's probably some things I'm missing.
Well, one thing that I like about this strategy is, so many times when we think about, okay, how do we transition our annual giving asks and donor engagement online? It's kind of creating it out of nowhere, right? We're sort of saying, you know, we have donors used to one specific method of hearing from us, and now we're trying to launch that online, and sometimes it can feel like an uphill battle. And one of the things that we're really benefiting from with this campaign is that the structure is in place on the ground. We have fundraisers, we have 120 volunteers that are committed to fundraising for this campaign every year, and they're just so used to doing it door to door and you know, asking people in their community. And so now we're really unlocking their potential by providing them this portal. And so it's nice that we don't have to create the peer-to-peer site and then recruit people to fundraise via the peer-to-peer site. We have those volunteers recruited, so it's a great way to launch peer-to-peer online giving for our entire system by starting with this, as Natalie mentioned, starting here with pennies by the inch, starting with the legacy, starting with this engaged base who's already used to making asks. And now we're just asking them to go beyond their physical neighborhood and go to their virtual neighborhood. And we're using TeamRaiser to do this. So we're fitting a little bit of so we've been working very closely with Andrea. And again, Andrea's doing a magnificent job translating a platform that's typically used for races to become this kind of this more year-long peer-to-peer based platform. And Andrea, do you want to add anything about this? Because you've really been helping drive this.
Sure. Yeah, I think you spoke to that well. This campaign has, like you said, it's 97 years old. It has a structure that's already known and understood by many of your longtime supporters, and TeamRaiser enabled you to pretty much maintain that structure. You had to make a few adjustments, which sometimes requires a little flexibility and creative thinking, but you all did it. And so you were able to map over the structure you have of districts and district chairman and co-chairman and volunteers, and that's all going to come over. We're also making use of data imports and uploads to easily onboard several hundred known supporters, which we don't always do with TeamRaiser, but it's a great way to seed this campaign. And then, as you said, people will be able to come here on their own and start something if they'd like to, either as part of the Pennies by the Inch campaign or just their own lemonade stand or their own kind of thing they want to do to fundraise. So yeah, I think it's I'm excited to see how the results do, because you've got a $1 million goal, and I think you're going to make it. I know you will.
Andrea, thank you so much. I appreciate you mentioning that about the data, because that was definitely an attractive aspect of using TeamRaiser and using Luminate, is that it is very slick to be able to import all of the data that we already have in our database and with the system that we use, and the sort of seamless transition that's going to be, and how intuitive it is makes a huge difference in how quickly we're also trying to turn this around. So this has been a really great experience.
And one thing that I'm also really looking forward to with that data import is, because with all these volunteers, this is very new to them, and being able to say, you now have a page, rather than log in, get a page set up, here are the instructions. We're really reducing that barrier to access, because it will already be, our group of volunteers, they are on Facebook, they know how to interact online, and are still of the mindset they're nervous. They're a little fearful about, they want to do it right, and so being able to surmount that hurdle for them I think is going to pay off, but TBD, we'll let you know.
Well, and what a great color palette too, and I love the calls to actions with the different colors. It just makes it very easy to locate the primary actions, and yeah, great way to bring a legacy campaign online. Well done, everyone.
Thank you. Thanks.
All right, so moving into stewardship and donor relations.
Yeah, so this is Lisa, and I'll just kick it off with kind of an overview of where we are. We have a stewardship and donor relations program that is only 2 years old. So we have a lot of donors for many, many years who haven't really been stewarded in a best practice manner. And we also are getting a lot of new donors every year because we do have organized programs now that focused on fundraising and annual giving and major giving. So we're trying to accomplish two things: make sure we keep those new donors engaged, and also really doing a lot of going backwards and trying to re-engage or get former donors engaged again. So we have a lot of projects for those past donors, including donor walls and recognition, and some recognition that just hasn't been done in the past. And then we also have lots of events happening, as you can see with annual giving, lots of campaigns, lots of fundraisers, things like that. So we'll just give you kind of a snapshot of some things that we've done in the last few months to accomplish some of those tasks. For our former donors, we don't have a lot of emails, but we didn't want to not utilize Luminate to communicate with them, because, you know, again, we're just trying to reach everybody on any level that we can at this point. And then with our new donors, you know, we want to make sure we're inviting them to events. We want to make sure we're communicating with them much more often than we have done in the past. So what Emily's going to talk about is kind of an example of what we've done so far.
Yeah, so as Lisa mentioned, we haven't had a stewardship program for a very long time. Stewardship activities have kind of happened on an ad hoc basis, and so using Luminate has really allowed us to sort of diversify and standardize the way we communicate with our donors and kind of help them get used to hearing from us in different ways. And so one of the most useful things about Luminate, I think, is the copy feature. So we're able to copy previous email campaigns and have them look the same header, the same sort of body layout, so that when donors get an email from us, it's sort of they can recognize it quickly, and then they can get used to hearing from us and engaging with us that way. One kind of success that we've really had as far as a stewardship email, Britt talked earlier about our Festival of Trees event, and it takes up a lot of time for everyone. And so one of our main activities that we've done is we've sent out an email to everyone who attended the event, whose email we were able to get. And after the event, we sent out just sort of an email that had a video from the event with one of the children that spoke, and so it was really meaningful. And it also sort of included a total of how much we were able to raise. And so we sent out that email, and we actually had almost a 55% open rate, and of the people that we sent it to, so we sent it to about 6,500, almost 600 people actually opened the video and were able to watch the video. And so even if they weren't able to attend, they were still able to sort of get connection and sort of connect with our meeting and with the event. So that was really awesome. Yeah, so if you want to move to the next slide. Another big focus that the stewardship team has had with Luminate is getting information to populate a donor wall. So right now we're in the process of putting donor walls up at most of our hospitals, or replacing the donor walls. And so a really important part of that is making sure that we recognize the individuals on these walls accurately and correctly. And so we have been sort of testing how donors respond to us emailing them about their preference. It's a lot more organized if you collect information via email than it is collecting it via snail mail. It's a lot faster and it's a lot cheaper. So ideally, we'd love to move to a scenario where we can just collect the information online. But as of right now, that's not really feasible. But what we did is we created a survey within Luminate, and so we would send out an email to each of the people that are on the donor wall and say, you know, this is what we have currently. Will you complete the following survey to let us know whether or not this is correct, or if we need to have any updates. And so this is kind of nice because it'll act in the future as kind of a less formal contract. So we've shown them what we're going to put on the wall, and then, you know, they, by opening the survey, then agree to it or change it. And then, you know, if there are any discrepancies later on, we have this as kind of proof that we, you know, reached out to them and tried to contact them. That's been fairly successful. Of the emails that we've done this twice for 2 different hospitals. We have about a 20% click-through rate for the emails that we send to people actually going to the survey and completing the survey and so letting us know whether what we have is correct or incorrect. So that's been really nice, and it kind of just allows us to supplement the snail mail that we send asking them to verify their naming. So that's been a really, really helpful tool, and you can sort of see on the screen that that's what it looks like. We actually show them what we have, and then when they go to the survey, they again see, so it kind of reinforces to them and lets them see what it's going to look like on the wall. Yes, if you want to move to the next slide, please. Lisa will jump in here with me. A couple of future plans that we have. We are hopefully going to move towards doing some donor surveys that we will send out after events or after we have donor wall openings to sort of get donor feedback and see what we're doing that they like, what we're doing that we can improve on. That'll kind of go along with our continued effort to do more post-event stewardship, send out videos and other emails to those who attend our events. Yeah, anything you want to add, Lisa?
Yeah. Also, because we do have such a nice foundation of donors who have been giving for years and years without much stewardship, we want to hear from them. We want to know, what they would like to see, what we're doing right, what we can improve on, and then also, of course, with our new donors. So doing donor surveys is definitely top of our priority list. We just want to collect as much feedback as we can as we're building our program into a best practice program. Our foundation does a lot of events. We have a lot of golf tournaments. Because we have 22 hospitals, each of those hospitals kind of has this tradition of, events that they've been doing for years and years. And so we want to capitalize on that as well and make sure, number one, that we're thanking the people who participate, but also communicating impact and communicating, the difference that they're making by participating in the event. And then, of course, what difference they can make by continuing to be a donor and continuing to be engaged with us. Also, like the Festival of Trees example that Emily shared, the video was a thank you video. And so, the intention was not only to help them connect with the mission of Festival of Trees, which kind of sometimes gets lost because it's such a fun event, but to make sure that people, got a thank you message and felt like, oh, I really participated in something bigger here. Of course, we have a lot more donor walls to do, so we'll be continuing to communicate with our donors to confirm how they want to be recognized. And then, of course, we want to do a lot more communications with the digital. We don't have any kind of newsletter or anything currently, so we're kind of trying to go from like 1950 to 2020. Skip everything in between. So we know there's lots of things that we haven't been doing in the past that are just best practice kinds of things, but we're just kind of skipping ahead and just saying, you know what, let's just start doing things the way that it needs to be done right now and the way that we know that the world wants to communicate. And so Luminate has just been so great because we've been able to achieve those things that we haven't, that before would have taken us a long time. And the 2 donor walls that we've done in the last 6 months, so much effort went into planning the wall itself because it was planning what they were going to look like for all of our hospitals, that we kind of got down the road and realized, oh, we should have sent our letter 2 months ago, right? And so Luminate was great because we were able to capture a lot of people quickly that we otherwise probably wouldn't have been able to do in the time frame that we had. So, and then the other thing too that I don't have up here is just engaging our new donors. And again, we have most of our new donors we are collecting emails for. So we want to make sure that we get them a welcome message and as they give for the first time, that we welcome them to our family. So that's another area. And I think that's it for us.
Terrific. Oh, that's a lot. Thank you. All right, and I think, Rebecca, when we talked about this, I think you articulated this best. If you want to kind of walk through this.
Yeah, I think the big thing for us is, I think as all of our team has shared, Luminate Online is a very user-friendly product and has a lot of functionality built in to the overall platform that has been able to be utilized by all three of our teams. And I think one of my mottos to our team, because we are, we're doing traditional work, but in a new way with these three teams. And I always say to my team, don't let perfect get in the way of progress. And I think that a lot of times when an organization is considering a product like Luminate Online, because it has so much functionality, you feel like you have to do all of it at once. And I think we are a great example of incremental progress, implementing things in phases. Now, I would say that, as the second bullet points out, having an implementation partner allowed us to not let perfect get in the way of progress. And so I think that that is a key element to our success. And we would not have been able to do what we've done without an implementation partner. So I don't want to give anyone any false impression. I think that was an absolute, our partnership with Cathexis has been key and will continue to be key in our plans to move forward with the product. And then I think, the other thing I just want to say is to each of the managers and our development coordinators that have participated today, I give them a lot of credit, because some of this can be overwhelming, especially if you don't have maybe a background with, online giving or HTML or a lot of the stuff that we're doing. It's taking people out of their comfort zone. But we have an amazing team who digs in, and they're excited about the possibilities, and they're not afraid to try things. And we learn whether we're successful or we have areas for improvement. We're learning through this process. And then I think another thing which Brittany mentioned earlier that I want to reemphasize is a lot of organizations will typically organize around having a team that does their online giving and handles a lot of their e-communications. And when we went through our redesign as a foundation and created these teams, we call them swim lanes if you're into continuous improvement. But as we created our teams, I really advocated for taking an approach where we would have a development coordinator who would be assigned to each of the teams. So Natalie, Emily, and Brittany formerly were on a larger team that was a part of our foundation's kind of data services and gift processing team. And we wanted to make it so that we had someone dedicated to each of these areas, because in the past what would happen is we were kind of vying for resources and you had to be in the queue, and it was really slowing down progress. And so now it's really great, because if annual giving has an idea like the balloon campaign, they don't need to then get in the queue and try to vie for other resources that might be needed for end of year giving and processing gifts, because now Natalie can work with Danielle and they can implement that quickly. So I think that that's really been a key to our success, is this model of having someone dedicated to each of those three areas and not having to then vie for, getting in a queue and vying for resources. So those are just some of the things that I think have really allowed us to see amazing progress. And I would offer, open it up to anyone else on our team if they have anything they wanted to add to that.
Yeah, I think that having the development coordinator, this is Lisa, is absolutely key, because they are able to specialize kind of in that area. And then there's recognition from project to project of, because it's repetition. And so rather than having a new person assigned every single time, just depending on who's available, this works much better, because they're familiar with the project, and then it just becomes easier and easier, and then can offer insights and can even work with each other, because there's a lot of overlap. So it just makes it so much easier. It probably seems at first like, wow, why are there 6 people talking about these projects? But that's kind of how it goes. Is we have, or 7 actually, we have. Each of us owns a piece, and it just all works together really well to have that dedication and expertise in each of those areas as we work on each of these projects.
Well said. All right. Anything else to add to that? Anybody?
Nope.
Well, while we're waiting, go ahead and if you haven't thought of it, feel free to ask any questions you might have in the question box there. You're all on mute just to help cut down on the background noise, but please, we're interested in any questions you might have, so feel free to ask those. And while we're waiting, I just want to give a huge shout out to the team. This is kind of a dream team to work with, and not just because they say really nice things about us, but also because they really, as you can tell from listening to them, they really got it. They really, took hold of the project, the platform, dug in, rolled up their sleeves, and learned and thought outside the box with us, and really stretched, what's possible, and saw the value in what they were doing, and you could see from the results. They're being very successful so far, and I expect a lot more of the same moving forward as they kind of take it to the next level. And just definitely the type of crew that we love to work with, because products like Luminate are very robust, and that's a great thing. And it just takes a little bit of time to get you to know your way around, and you can see from some of these examples how much time they can save and put towards other ideas and other areas to focus on, instead of little menial tasks that can be much more automated. All right. I'm not seeing any questions, so I think we just covered everything 100%, and no one has any, so that's terrific. I just want to again thank the entire team for joining the call today and giving their input and lessons learned and results, and Andrea as well, and everybody on the line. Thank you for your time. Feel free to reach out to me directly if you have any questions. Check out our website, sign up for our blog for more information. We have been recording this session, and we'll be making it available if you want to review it in the future. But again, thank you everybody for your time, and have a great day.
Thank you.
Thanks.
Thank you.